Hi guys, my name is Elizabeth Broker and I am going to kind of give you a quick rundown on working in a multi-generational nursing team for my senior capstone. So this project came from a place I have worked in, multiple different areas in nursing, and I've also been trained by multiple different preceptors. And every nurse, I'm sure, is familiar with the phrase that, nurses eat their young. I think in that phrase itself has a lot of opportunity for growth just within that phrase. I think that this is something that a lot of people don't know about. So I'm excited to kind of present to you how these generational differences can really make an impact in your nursing and the tension that can be a result of this. So, at any one point in your nursing career, you might have four generations working together simultaneously. These generations all have different sets of values and beliefs and views. These play a critical role in nursing practice and can lead to generational tension and misunderstanding. Looking at my thesis statement, when precepting new nurses or training existing nurses, generational differences should be a topic that is brought to light. In doing so, you could reduce generational tension and misunderstanding within the workplace, which in turn could lead to decreased turnover and greater job satisfaction among nurses. So just looking at some nurses right now, the different generations that you might see in your workplace. Veteran nurses, these are, your oldest set of nurses that are in the workplace, or maybe they've already actually retired since, they were born from 1923 to 1943. These nurses' typical traits: they're reluctant to use new technology. However, they're loyal to organizations and administration. They appreciate well-defined goals and adhere to rules. Next up is baby boomers. These nurses have a great sense of loyalty. They're very similar to veteran nurses. They're interested in new education and information. In fact, they hold education at a very high standard, and they get fulfillment and self-worth from a job. You have your Generation X nurses next. Those nurses were born between 1960 and 1980. These nurses thrive on self-direction and are known for being very independent and comfortable with new technology. These nurses also really prefer learning with visual methods, compared to other methods that you might use. And last but not least, you have a Generation Y nurses. These nurses were born from 1980 to 2000. They're known as millennials. They make up the second largest group in nursing today. They have a deep value for instant feedback related to their work performance, and they thrive in a creative and flexible environment that allows them to have a good work-life balance. Looking at my SWOT analysis. So as far as education on generational differences for new and existing nurses, these are the strengths, weaknesses, opportunities, and threats that this opportunity for growth can have. So looking at strengths, cost is one. The amount of money that could save a hospital in turnover is monumental and well worth trying based on cost alone. Communication, this is definitely training that can strengthen communication among nurses in the department and hospital. Weaknesses, the resistance. There might be internal resistance from employees that don't think that this training is beneficial or relevant to their nursing practice. And continued management. So managers themselves would really have to continue to evaluate and reevaluate to ensure that this initiative and training is successful. Your opportunities for success. So turnover is huge with national turnover rates on the rise. This has the opportunity to decrease burnout association to conflict in the workplace. Awareness. Moving forward, other employees can become more cognizant of these generational differences and how it can be used in the workplace. Threats. So training. There's no specific training in my research that I saw or qualification that this education seeks to complete. So this is a relatively kind of unheard of concept, that generational differences, although there's plenty of research out to support the fact that these generational differences can cause conflict in the workplace. There's not a lot of education out there specifically on what you can do to mitigate those differences. So, and then outside evaluation, we have already been kind of talking about that because the education is so new. It's hard to compare it with any other hospital. You can't say hospital A is doing this at their hospital to reduce conflict in the workplace, or hospital B is doing that. Like I said, it's a very, very new concept, or at least it's a concept that hasn't been heavily researched or investigated. So what does the literature say? There is a definite correlation between workplace satisfaction and the understanding of a multi-generational nursing cohort. Looking at cost alone, between 2012 and 2014, turnover rates rose from 14.7% to 16.5%. These turnover rates equal huge costs to hospitals. On average, hospitals spend between $4.2 and $6 million alone just on turnover costs. Taking cost out of the equation completely, it's noted that generational differences can lead to conflict between staff. This conflict among staff can lead to overall group instability, which obviously is not only good, not good for nurses, but it's also not good for patients either. Nursing turnover, burnout, and staffing shortages can be directly related to teamwork in a multi-generational nursing cohort. So leadership is going to be huge in implementing any kind of change when it comes to a multi-generational cohort. So the leadership in a department can be a huge factor in the creation of an environment that benefits both nursing staff and patients. For this specific project, I think that a servant leader would be a very appropriate leadership style to implement when making this change. So a servant leader, they ensure the team is successful by ensuring that they have necessary skills, relationships, and tools to tackle group and individual goals. Servant leaders' predominant traits, the main goal of a servant leader is to serve staff. This is in total contrast with other leadership styles, which use management as a means of control for their employees. Literally, what it comes down to is a servant leader performs duties for others, and their main goal is to serve staff. So what does that look like in a multi-generational nursing cohort? This leadership style works well with a diverse group and with different objectives and tasks. That's why this would be a perfect leadership style for a multi-generational nursing cohort, because you're looking at 4 different generations, which is a very diverse group. And these generations all have their own unique set of ideas, views, and beliefs, and they also have, strengths among them that could be capitalized on. The main purpose of this training would be, it's an opportunity for growth to be focusing on mitigating these differences and then capitalizing on the strengths that each generation has. The American Association of Critical Care describes servant leaders as inclusive of all staff and sees value in everyone. They attempt to maximize strengths of all who work for them. And then next, kind of as far as a change theory goes that your leadership can be using, I definitely think Lewin's change theory would be an appropriate theory to use. Implementing change in a workplace can be hard, as it comes with, demands from external sources, resistance from employees, and then competing ideas. Lewin's theory has 3 different stages, the first of which is solely focused on rejecting prior learning or habits and a means to later be able to replace it with new learning. So looking at Lewin's theory, there's 3 stages as previously mentioned. There's unfreezing, change, and then refreezing. So unfreezing, basically, that's when you're going in and you're trying to reject old learning or maybe old learned behaviors. This is going to be huge for that. You can teach this in a nursing cohort, and you can, really make others kind of acutely aware of their generational differences and how it impacts their work. So the unfreezing stage is going to be huge. This is also where you're going to gather baseline data. So, about things like turnover or job satisfaction in general. This is where nurses are really going to be able to get rid of prior learned knowledge that they have, or maybe they already have ideas that are kind of very hardwired in their brain about what other generations, look like and how that impacts their work performance. So that's where, you're getting rid of those. So then you can move on to the change stage, which is exactly what it sounds like. That's, where we would be presenting this education. So nurses would be, acutely aware of these differences and how it can really help with patient care and impact, generational tension within the workplace. The last stage of this theory is the refreezing stage. So this stage is huge. This is where kind of everything that you've learned in the whole process is really cemented into place. Skipping this stage is really not recommended because, if you do skip this stage, it's very easy to fall back on old habits. So evaluating this change is going to be hard. Obviously, like I said earlier, there's not a lot of, education out there on this. So good baseline data is really going to help. I had mentioned earlier looking at job satisfaction among nurses that's reported, and then turnover rates too. You could definitely look at those in comparison with this growth opportunity to see if this has been successful. I think it would be appropriate to evaluate this change after 3 months, 6 months, and then annually after that. And then after a year, if there's still tension or conflict within the workplace, it might be appropriate to look at other areas for improvement purposes. So in conclusion, understanding the differences that can occur in a multi-generational nursing cohort could be the answer to ending tension in the workplace. There is no one-size-fits-all solution by any means when it comes to solving these generational differences in the workplace. However, using a leadership theory and change theory can help guide your way. And those are my references, and that's it. Thank you so much for watching.